Welcome to the Wild Physio podcast with your host, Andrew Wild. Today, I'm super excited. I have Elisabetta Brigo on, who is a physiotherapist from Northern Italy, and she has recently started her PhD in Rehabilitation Sciences at Hasselt University in Belgium. I think I've got that pronunciation correct.
Yep.
She is passionate about divulging evidence-based information on topics related to pain, injury, and rehabilitation. And she does so by creating and sharing educational content, which is phenomenal online, by the way, mainly on Instagram, where you can find her at the.physio.formula. Her hope in doing so is to help people discern what is actually backed up by science, which I love, and what is instead utter nonsense. She's always happy to connect with new people and engage in fruitful conversations, so feel free to get in touch with her anytime. A huge welcome to Elisabetta. How are you?
Thank you so much for having me here. I'm really happy that we are going to do this. And I really hope that whoever is going to listen to this will take something home with themselves, like, maybe learn something, or I hope it's going to be helpful.
I'm sure a lot of people gain a lot of knowledge and information from this podcast. I'm really looking forward to hearing what you've got to say. And by the way, your Instagram page is phenomenal. I think it's one of the best ones out there for new grad physios and young physios. I think it's really easy to understand. I think it's also very aesthetically pleasing. So I often, when people ask me, who should I follow? You're definitely one of the people that I tell to follow. So.
Thank you. I really, really appreciate it. Like, sometimes I fear that maybe because I try to make things, complex topics, as simple as possible to understand, even for people who don't have a background in physiotherapy or rehabilitation. And sometimes I feel like maybe being nuanced, like it's not always easy on social media to show all the shades of a certain topic, but that's kind of like the issue when you try to simplify topics. But I always try my best, of course, to share what the current evidence says.
I think you do an amazing job of that. And as you've said, via email and Instagram, the fact that English is not your mother tongue, in inverted commas, you do such a good job of it, because obviously Italian is your I suppose your first tongue or a language that you learn. Yeah. All right, let's dive into some yes, no, or maybe questions. So you got to answer with a yes, no, or maybe, and then we'll dive into why you said what you said. Okay, first one. Can you prevent back pain by avoiding so-called incorrect postures?
No.
Is the use of phones poorly correlated with neck pain and disability?
Sorry, can you repeat, because I didn't hear?
Is the use of phones poorly correlated with neck pain and disability?
No.
Is there such thing as correct or perfect posture?
No.
Is adopting more comfortable postures safe, even if it doesn't look anything like what they are everyone thinks is a perfect posture?
Yes.
Is there a single spinal curvature that is strongly associated with pain?
No.
Is sitting in one position dangerous, and should it be avoided?
No.
Does postural and movement screening prevent pain in the workplace?
No.
Should we be afraid of Buttwink?
No.
Is bending or flexion of our spine unavoidable while squatting and deadlifting?
Yes.
Is it possible to reliably tell if a Buttwink is present?
No.
Just by eyeballing it. Yep.
Yeah. No.
Does so-called correct form in the gym reduce the risk of injury?
No.
Great. Done.
Okay.
All right.
I passed the exam, maybe.
Yeah, you passed. Let's go through each one and why you answered like you did. The first one was, can you prevent back pain by avoiding so-called incorrect postures? And you said no.
No.
Why?
First of all, because what is incorrect posture? There is no good, bad, or even perfect posture. Posture is just posture. And back pain, we know it's always multifactorial. So even like the biomechanical postural aspect is only one small piece of a much, much bigger picture. So even if we took care of, let's say, we could address posture, we would still have so many other factors like psychological, social, environmental, cognitive, emotional, like so many other factors. So no, we cannot prevent back pain by addressing posture.
So if someone comes into your clinic, or there's young physios out there that consistently see people walking in and saying, I need to fix my posture. My posture is one of the reasons why I have back pain. How would you go about, I suppose, debunking that myth? And how would you then frame the conversation around posture?
It's always like tricky, because it always depends on the person you have in front of you, because some people are open to listen to you and maybe change their opinions. Some people are really attached to what they believe. So in that case, it's much, much harder. I would probably start asking, why do they think the cause of their pain is their posture, and trying to listen to them and what they have been told, or how did they reach that kind of belief. And then I would ask them if indeed they are open to listen to maybe a different point of view. And if they are, I would try to explain them what the current evidence tells us. It's important not to kind of dismiss them, but always we need to validate the patient, of course. But if they have unhelpful beliefs, it's always useful if we can modify those, of course, because it is known that someone's beliefs do impact their prognosis also. So if they have unhelpful and like wrong beliefs, their prognosis could be worse. So yeah, it's always worth giving it a try and educate them on what the current evidence says.
Yep. So for the listeners out there is no such thing as correct or perfect posture.
Indeed. Yeah.
Yeah. And I often tell clients, your best posture is your next posture, because changing it regularly is a really good thing to do. And you said, is adopting more comfortable posture safe? And you said, yes, it is. And it doesn't need to look so-called perfect.
Exactly.
So when it comes to comfortable postures and, slouching and moving around and changing positions, or even if, working from home in the last couple of years, what are your recommendations when it comes to positioning? Are you telling people that they can move around as they see fit? They can move around into different positions that feel comfortable? What do you normally tell your clients or your patients?
I don't like to give too many instructions when it comes to posture, because I want them to feel as free as possible to move and keep whatever posture they feel comfortable in. So I think we should try to keep the message as simple as possible. Keep whatever posture position is most comfortable for you, and when it's no longer comfortable, just change it. That's the message I would give to people. Because even no posture can prevent pain. Doesn't matter how good it looks from the outside, no posture can prevent pain. And the common advice that lots of healthcare professionals used to give, and maybe still give to patients, to sit up straight, it's actually not evidence-based, and it's actually fear-mongering. And that's something we want to avoid. So yeah, keep the message very simple and make your clients, your patients feel as free as possible to move however they want.
Really well answered. And when it comes to postural and movement screening in the workplace, you said, does postural movement screening prevent back pain in the workplace? You said, no, it doesn't. So all of those symbols that they have around workplaces of people picking certain things up, like boxes, and there's like a tick next to someone picking it up, where they're bending their knees, and people get taught this stuff in OH&S and everything.
Yeah.
And then there's a cross against the person bending over with their back really flexed, and there's a big cross saying, don't do it like this. So why is that still being taught? Because it clearly has been debunked by the research.
I mean, I would love to know that. Like, I kind of hate those kind of images where with the check mark and the X. Like, I really don't understand why they're still around. They are just nonsense to start with, and they can induce fear in people for no reason. They make people fearful of certain movements, certain positions, and it makes literally no sense, because no movement is inherently bad or dangerous or injurious. So yeah, there's like, we need to change that. There's a those kind of images need to disappear, in my opinion. Yeah, also, it's been shown that it kind of appears that when we try to force ourselves to maintain those good or recommended perfect postures, we kind of have more spinal pain, where it's been shown to be correlated with more spinal pain, maybe because we tense up a lot. And when we tense up, we kind of feel more discomfort, you know? So that's why I say, keep whatever posture is comfortable for you. It doesn't matter how it looks from the outside. As long as it's comfortable for you, it's a good posture for you. And then just change it when you don't feel comfortable anymore.
Yeah, I completely agree. And I've had multiple patients over the years come in, and they've been trying to maintain a so-called perfect posture. And that's been the cause of a lot of their pain, because they're trying to maintain this perfect posture for hours on end. And the analogy that I often use, and as soon as I tell them just, start adopting more comfortable postures and move around and change it regularly, then they feel better straight away, pretty much. It doesn't take much. But what I often say is, if you get someone sitting up in your so-called perfect posture regularly, it's like squeezing your fist like this all day and holding it all day like that. And then at the end of the day, trying to shake someone's hand or pick something up, the muscles are just tired because they've been on all day. So we want those muscles to relax when they don't really need to do too much work. And then when we need them, when we're picking up something heavy or we're deadlifting in the gym or something like that, then they're working.
Yeah, exactly. Perfect. Yeah, I love that analogy. I think I will use that. I will steal it from you and use it in the future, the fist analogy. Yeah.
I'm not going to claim that one. That's a Peter O'Sullivan one. I'm not going to claim that.
Okay.
Yeah. And when it comes to, you said, is there a single spinal curvature that is strongly associated with pain? You said no. So
no.
The amount of people that walk in my door and say, I have back pain because I have a scoliosis, or I have back pain because I have more of a anteriorly tilted pelvis or whatever. How would you go about talking to someone about those beliefs?
Again, we always need to approach them like with some like trying to approach the client. Let's see if they're again open to change their mind or not. But if they are, I would say that I would explain that scoliosis is actually really common in the population, different degrees, of course. It doesn't have to be like very severe, but so many people go around with their lives with no problem at all, completely asymptomatic, and yet they have scoliosis. And maybe they find out one day because, I don't know, they go see the doctor one day and the doctor notices, you know, and they've been living the whole life with no pain at all. Yeah, like what the current evidence tells us is that there is indeed no single spinal curvature is strongly associated with pain. Okay, so we cannot think that just because someone has a scoliosis or a kyphosis or a pelvic tilt, like a very accentuated lumbar lordosis, then they have pain or will develop pain. We cannot know that. Regarding the pelvic tilt, the vast majority of the population has a tilted pelvis, most like about 80% anteriorly tilted, 5% posteriorly tilted. So almost everybody has a tilted pelvis one way or the other, and without any symptoms, so completely asymptomatic. So I'm wondering, is it really a dysfunction, or is it just how human beings normally are, you know. Yeah, so I don't know why also the pelvic tilt is so, I don't know, pathologized. It's completely normal, literally. If you don't have any symptoms, you shouldn't worry about it, in my opinion.
Yeah, I think scoliosis gets pathologized as well. You know, it's like a badge. You know, I've got scoliosis, and that's why I have back pain, and I've had ongoing issues because I've got scoliosis. But yeah, as you said, there's a lot of people out there. There's millions of people out there with a scoliosis and they don't even know that they have it.
Yeah,
and
exactly.
Often the people that know they have a scoliosis, they didn't know before they went to a healthcare practitioner. You know, they went to a chiropractor, a physio, or someone, they did an x-ray, or they just eyeballed it and they said, you've got a scoliosis. And all of a sudden they think that they need to be mindful of that going forwards, and they need to protect their back because they've got a scoliosis. You know, it just creates immediate nocebo and fear.
Yes. Even if the doctor or the healthcare professional means well, you know, oh, you have a scoliosis, just maybe they just point it out, maybe. And that's sometimes enough to make people fearful and start this kind of fear avoidance strategies, or thinking too much about their scoliosis, which can then lead to pain, but not for the structure of the spine, but more because of psychological factors, maybe, you know, like increased stress and anxiety, you know. So yeah, it's important to remind people that no single spinal curvature is strongly associated with pain. That's a really important message.
Yeah, I think that's a great message. And people shouldn't be walking out of a consult feeling more negative about their body than they did when they first walked in. So I think that's really important, and being positive and not providing any nocebic language is super important, so the client gets a really good result.
Yeah.
And when it came to your answer about sitting in one position, is it dangerous and should it be avoided? You said, no, it's not dangerous. And if someone sits down for 2 hours in the same spot, are they going to get pain?
It's very subjective, to be honest, but sitting longer than 20 minutes is not dangerous. It's it's better maybe if you move, of course, if you change posture, but it's not dangerous or unsafe to maintain a posture for longer than 1 hour or more. I mean, how many of us maybe like sit on the couch in the evening and stay there for hours, you know? It's not unsafe, it's not dangerous. So yeah, that's you can maintain whatever position you want for as long as you want, and it's not dangerous or unsafe.
Yeah, great. And if someone ever comes in and sees you and they want to improve their posture, and that's a real goal of theirs, what do you do with that client?
I would like to see why they want to improve their posture. Is it because they believe bad posture, like what looks like bad posture, causes pain, or is it just for like I don't know, like aesthetic purposes maybe, or to feel more confident, you know? Because sometimes like posture is not fixed. Sometimes, lots of the time, posture reflects mood and thoughts and belief. So maybe we have a more, I don't know, flex posture when we feel sad, and we have a more erect posture when we are happy or confident. So I would try to see the reason why they want to change or correct or improve their posture, and work from that. Yeah.
And
maybe they just need
there's obviously a genetic component here as well. You know, some people have more of a kyphotic presentation, so they've just got more of a rounded section through their thoracic spine, and that's, you know, you can't change. And I talk about this with the hip often. You know, a lot of people trying to do all these mobility drills, and they're just hitting the end of range in their hip all the time. And they're thinking that they're going to change their hip mobility when they're hitting the end of range. And the only way to make it better is if we went in and, you know, shaved off the bone to make it a little bit easier for them to get a little bit more range. So the genetic component has a big correlation to what you can and can't do in terms of certain ranges of motions you can get into.
Of course, like there is a huge anatomic variability within between people, of course. So yeah, we cannot change the structure of the bones. we need surgery to do that, of course. Yeah.
Exactly. All right, let's dive into Buttwink. All right, so when I asked, should we be afraid of Buttwink, you said no, because the amount of people I see online talk about Buttwink when they've got no idea what they're talking about. And they say that Buttwink is bad and you should avoid Buttwink. Why did you say that we shouldn't be afraid of Buttwink?
Because it's a movement that naturally occurs at the bottom of the squat, first of all, because we need to keep in mind that there is a very close relationship between the lumbar spine and the pelvis. So with increased degrees of hip flexion, the lumbar spine will go into flexion, causing this the Buttwink, what is called. And just like any other movement, the Buttwink is not inherently dangerous or injurious. There was like a study that was looking at like elite athletes, like rowers, who underwent like lots of flexion and extension of the low back under load for many years. And they saw that the prevalence of back pain among these people was not any higher than in non-athletic populations. So there is no reason really to fear the flexion of the lumbar spine during the Buttwink at the bottom of the squat, even if you do it for many years repetitively. In addition to that, I would say that it's indeed unavoidable, but even if we try to avoid like this lumbar spine flexion, because maybe, I don't know, I think the Buttwink has been demonized because of the lumbar spine flexion, maybe causes damages to the intervertebral discs, but actually the discs can get injured even in neutral spine ranges, you know? So in any case, like there is no spinal position that can prevent discs from possible injury. So that's another reason why we shouldn't, it makes no sense that we try everything to avoid the Buttwink.
And when you see online people talking about Buttwink and they can see a Buttwink, when I asked you, is it possible to reliably tell if a Buttwink is present? You said, no, it's not. And some of the research that I looked at, it was 34 degrees of posterior pelvic tilt is required for visual detection. And that's a fair bit. So
yeah, exactly. So maybe the Buttwink is actually occurring even when people don't think it's occurring because they cannot visually assess it. Visual assessment is not accurate to detect the Buttwink anyway. So yeah, what is the point? We said that it's a normal movement that naturally occurs. It's not inherently dangerous. Trying to avoid it does not prevent you from getting injured, and you cannot even accurately detect it like visually. So why are we still discussing about the Buttwink? Why are we still demonizing this movement? You know? I think it's just like any movement or posture. It's all about gradually getting used to it. You know, just allowing our body to accept a new move, accept a new load, or get used to a new movement. And if we build that tolerance, that capacity gradually, we're good to go. There's no need to worry.
Yeah. So when we are squatting, what is your recommendation for most people? Just squat to a comfortable range that suits them. What is your typical recommendation?
Like when squatting, there is no one single perfect form that can fit everybody, because we all have our own anatomy, like specific anatomy. So I say play with your stance, how wide or narrow it is. with foot, the rotation, if you want to rotate your foot outwards, more inwards, you need to kind of, if you're like a real beginner, you kind of need to try different positions and see what works best for you. And we also need to keep in mind that the most optimal, let's say, lifting form will change according to how much load you place on your body, because the forces will also change throughout in your body when you change the load, of course. So there is, in that sense, there is no perfect form, not even for the person, for one person, because their form will be more optimal according to the context, to the load, the range of motion, the goals, So yes, and if I can add something there, I would say the lifting form, it's more important for performance goals rather than injury prevention.
Yeah, and that was the last question that I asked. Does so-called correct form reduce the risk of injury? So you've already kind of answered that. You're saying that it doesn't reduce the risk of injury if you're using correct form, but for performance goals, potentially using a more so-called correct form may help.
Yes. And again, it really, like, the most optimal lifting form will change according to the specific subject and context also. So I think that's pretty much it. Like, people think that if they have like the most perfect lifting form, then they will not get injured, but that's just not how it really works. Like, injury, a lot like pain, is always multifactorial. So even if you look at lifting form, which is like one small piece of the puzzle, you have so many other things to consider, like, I don't know, sleep, stress, nutrition, I don't know, like social or occupational situations. I don't know, there's so many things to consider always.
Yeah, no, I completely agree with that. And it frustrates me how many people online, on Instagram especially, talk about form and, how it has to be perfect, and they break down form with all these lines and diagrams and everything.
Oh, yeah.
And I really think a lot of I'm not going to rag on the personal training profession, but I think a lot of the personal trainers and strength and conditioning coaches go a little bit too far with this, because they want to kind of make sure that people think that they're smart and they've got something to offer, when if we look at it from a physio lens, we realize that correct form, and I'll put that in inverted commas, doesn't reduce the risk of injury. It's just really just for the performance side of things. So it's completely overdone, and it frustrates me because people often come in and see me for the first time and they're always concerned about their form. I'm like, how's my form? Like, your form's fine. Don't even stress about it. It's all good. Don't stress. Like, it really frustrates me.
I think, like, if you are like confident and comfortable with a certain lifting position, that is the most optimal lifting form for you in this moment, I think. Because also, like, even if I try to perform a squat, like, every rep would look different. I wouldn't be able to replicate the same exact form every time. So, and it's just within me. So you can imagine that between like different people is going to be even like lifting form will change even more, of course. It's very personal and context dependent. I'm not saying just go and lift however you want, of course, like, because you also want to be efficient, especially with the heavier loads, of course. But that's, again, for more like a performance perspective.
Yeah, exactly. It's performance efficient lifts. So exactly what we want to, like, we don't want to make things harder than they need to be.
Exactly.
Yeah. No, really, really well answered. And the last topic that we were going to discuss was staying up to date with research, because this is a real challenge for physios working full time. The first few years out of uni, they're seeing, I don't know, 50 to 60 clients or patients a week, and then they're going home and they're thinking that they need to read all this research. How would you go about it?
Okay, so definitely staying up to date is not an easy task, especially if we consider that there are so many papers constantly coming out, and you feel like so hard to keep up sometimes, no? But as healthcare professional, we have to search for the best current available evidence. It's like part of our job. And especially, it's even more important to update our beliefs when we are confronted with stronger and compelling evidence. So those two are really wanted to point those 2 points out. So we don't always have to look for papers ourselves. What I do, I subscribe to newsletters from, for example, the RSS feed from PubMed. I select the topics I'm interested in and the frequency that I want to receive new papers on the topic. So I don't know, like once a month in my email, I receive, I don't know, 5 new papers on the topic I selected. And that's one very, very easy way to stay up with the evidence. You know, it's not like I have to read 5-10 papers every day, you know, just you receive those 5 papers once a month. That's one way. But of course, you need to be able to read papers, which is like a skill that you become, it's like a skill, you become better at it the more papers you read. Of course, you need some basic knowledge, but that kind of, you acquire that at university, I think. And so, yeah, any physios should be able to read a paper, of course. Another way that I really like is social media, which can be tricky, I know, because on social media you find all kind of misinformation or nonsense, but also there's also really good content on social media. So my recommendation, it would be to find like really great people in your industry that actually share evidence-based content and not nonsensical one, and try to follow them and maybe also engage in conversation with them. That's a good way to also not just to be passive, but try to have a conversation and actively contribute to, like, if you are active in a conversation, you will remember things better, in my opinion, just rather than just like reading a paper or And other great ways, I think, to stay up to date is to listen to podcasts. I don't know, maybe you are in the car or you are just out for a walk, you know, you don't have to dedicate a specific time to listen to a podcast. You can just do that while you're doing other tasks, you know. And it's such an easy way, because usually in podcasts, like the evidence is it's broken down in really, really easy pieces of information. So you don't have to, I don't know, appraise a paper, look at all the statistics and stuff. It's so much easier when you listen to a podcast. And it's still a very valid way to stay up to date with the evidence.
Yeah, I completely agree. And if there's anyone listening to this podcast and they would like some of the, I suppose, the references for the posture and the Buttwink stuff that we've gone through today, I've got a list of those if you do want to reach out to me, and I can send those to you, and then you can have a read of them. I think I've got 6 with each topic that I think are probably the go-to ones you should read.
Yeah, and other ways to stay up with the evidence could be courses, reading blogs or books. It kind of depends on what you like the most, because I think there are so many resources, you know, and you need to find what works best for you, so that then you can build a habit out of it. Because it's just like going to the gym, you know, or exercising in general. You kind of have to build the habits, and then it gets easier to stay up to date. And even if you read, I don't know, 1 paper per week, it would be 52 papers by the end of the year. And that's a considerable amount, you know? So you don't have to make this huge effort to stay up to date. You can try to fit it in your week, in your weekly schedule, in your timetable, I don't know, like really small, dedicating really small amount of time, you know, like listen to a podcast, read 1 paper per week, very little things, but they add up. They add up, of course.
Yeah, agreed. And I think if you want more time to, look into papers and these sort of things, I would go to probably your boss as well if you're a new grad physio, and see whether you can, designate, 30 to 60 minutes a week where you go through a paper with another colleague or something like that. I think that's a really good way of doing it. And they should be, work hours where you're getting paid for those hours. I often,
definitely.
They should be work hours. And I often say, jumping in the gym should be viewed as work hours in a way as well, because you're learning stuff while you're in the gym, and you're playing around with different movements, and you're playing around with different sort of programs and exercises. So I think that's very valuable as well.
Yeah, I totally agree with you. I like that. I really like that. Yes.
Yeah. Well, this has been heaps of fun. We should do it again. I feel like we could even maybe we should get a roundtable podcast going with a few of the others as well.
Oh yeah, that would be amazing. There are like so many great physios and rehab professionals on Instagram. Yes, and would be great to do something like that all together. Yeah.
So this is your first ever podcast. How was it?
Yes.
Bearable?
Yes, my first ever. But it was so much more fun than I thought, to be honest. Yesterday I was like writing down all those notes of things that I wanted to say, but actually I realized like everything is already in my mind. I didn't really need to stress out so much.
Yeah. And that's how I want it. I just want it to be a relaxed conversation. It doesn't need to be.
No, it was really nice.
Doesn't need to be us spitting out all of these references and
yeah. No, but also I can also provide you with some references if you want to give them to your subscribers or listeners. I can totally do that.
Yeah, if anyone wants the reference list from either of us, just let us know, and we're happy to provide that. And where can the listeners find you?
I think I'm most active on Instagram. So at the.physio.formula, or just type my name, Elisabetta Brigo, and you can find me.
Great.
Instagram is my go-to social media platform.
And you're doing great things. I love your Instagram. It's so good.
I really appreciate it. Thank you so much.
No worries. It's been a lot of fun. Let's do it again soon. This podcast is live on Apple Podcasts, Spotify, all other podcast channels. Any last words of wisdom?
Let's be movement optimists and embrace all forms of movement instead of trying to limit and create unnecessary barriers.
I love that. That's a great quote. We should put that up on your Instagram.
Okay. I'll think about it.
Love it. Well, thanks again. We'll do it again soon. And as usual, stay strong.